if people don't get behind us and what we're trying to do in changing the path that our profession is on, there could very well be a day where you won't be able to find a physician who's going to fight really hard for both you and your baby, who their only option that they will give you in that situation would be an abortion. And so I think people really should think about that and think about the kind of care that they want for themselves, regardless of where you stand on the issue of abortion.
Hello and welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists. I'm Miriam Diallo, your host for today, AAPLOG's communications manager, and I'm also here with my two other hosts for this podcast, Dr. Christina Francis and Dr. Susan Bane, as well as Dr. Chris Cirucci. This is part two of a wonderful conversation that we were having about an exciting new campaign that AAPLOG launched to help to encourage pro-life advocates and pro-life medical professionals to mobilize behind life-affirming physicians as they forge a new path forward in medicine. In part one of this conversation, which is uploaded on our YouTube channel and on Spotify and Apple Podcasts, if you want to listen to that, we were talking about the impact that a extreme pro-abortion medical culture is having on medical professionals, specifically pinpointing the messaging that the American College of Obstetricians and Gynecologists, ACOG, has been putting out on this topic. I wanted to pivot real quick to talking about how this messaging is impacting not only medical professionals, but also their patients, pregnant women and preborn babies. Dr. Francis, what are your thoughts on that? What has been the impact of ACOG's pro-abortion attitude on your patients, pregnant and preborn?
Yeah, well, I think that it stems from the impact that they are having on medical professionals. And one of course, for our preborn patients, who so many are losing their lives through induced abortion, and when that's being promoted by a major medical organization. And again, not to just sort of pick on ACOG, there are other medical organizations, unfortunately, who have followed suit. But we do believe that ACOG is the leader in making that happen. So if they change course, I think the others would as well. Um, so of course, our preborn patients' lives are being significantly impacted. But also, one of the things that really sticks out in my mind is when we have this general disregard for the value of the lives of our preborn patients, that really has a trickle down effect in a lot of areas. So, not just through what we might commonly think of as, a woman finds herself with an unplanned pregnancy and she's in sort of crisis mode and not sure what to do. And she comes to her doctor and asks what she should do. And doctors now are trained to say, well, here's the number for the abortion clinic. You can just, and they're taught not to really delve into the reasons why, but just to write a blank check or write a prescription for her to go to the abortion facility. So that is happening. But also, I think the other large population of people that I think of are those families that get a potentially life limiting diagnosis or some kind of adverse diagnosis for their baby during the pregnancy. I know all of us have heard so many stories from families who have said that the very first thing, and almost the only thing in many instances, that they are offered is an abortion in that situation, where they're not offered support to continue their pregnancy or even creative ideas for how their baby might be able to be helped. But they really receive a lot of pressure to terminate their pregnancy. So there's that impact on patients. And then, of course, I don't want to take all the talking points. I know other people will have thoughts as well, but the medical and the psychological impact that we see on our maternal patients who either choose abortion on their own or are coerced into abortions, which we know often happens. And I think, there's this mindset amongst many physicians, even if they feel somewhat uncomfortable with abortion or they don't necessarily think that it's the best thing for their patients to choose, we are just so ingrained in our training in so many places that this is something that if your patient even mentions it, or even if they don't, that you should offer it and you should be completely, quote unquote, unbiased in how you offer that and not put up any kind of roadblocks whatsoever, or even really give your patient informed consent about it. And so I do think that patient care is suffering because of that attitude.
That makes a lot of sense. And yeah, clearly the impact is fairly comprehensive in terms of how it harms pregnant women, preborn babies. So there's a lot at stake here. And so, Dr. Cirucci, at this point in our country's history, what do you think that pro-life medical professionals can do to help change the culture of medicine?
Yeah, thank you. So I would say to my pro-life medical professionals to stand up for truth. We know that abortion harms women. We know that abortion is not necessary. Um, we know that abortion is not health care. And so I would encourage people to stand up for truth. I'd also encourage my colleagues to join AAPLOG if you're not already a member. AAPLOG has so many resources. I mean, I'm on the research committee and we produce these bulletins of practice guidelines and committee opinions that uh, really give a lot of guidance on how to care for both of our patients, mother and baby. And also, if you want to get more involved, we are happy to help you with that. We're happy to have more people more involved. If you want to go beyond membership and be involved in the work we're doing, please contact us. So I would say the main thing is standing up for truth, being involved with APLOG, but I would also encourage my pro-life colleagues to be courageous. You're not alone. There's a lot of us out there. Some people may be very quiet, but when you find out when you come to our annual conference is that, well, you're not alone. There's a lot of people there, and that's another great opportunity. So yeah, I just want to encourage people to speak for truth and um, hang in there and be courageous.
Mhm. Absolutely, and it's great that you mentioned, joining AppLog, not only for the community of pro-life colleagues that you will find there, and the support and the encouragement and the fellowship, but also the resources that AppLog has on its website. If you watched part one of this conversation, you would have seen the video where at the very end there's a link to aaplog.org/mobilize, which is a webpage that really puts all of our resources front and center to help you get more informed about about life issues, help you know what to say, give you the information that you might not necessarily be getting from other sources, to really help you speak out as is needed. Yeah. Dr. Bane, we have there's pro-life medical professionals, but there's other pro-life advocates who are probably listening to this podcast as well. So whether they're in media or policy or nonprofits, what can they do to support pro-life medical professionals as they try to change this culture of medicine?
So before I specifically answer that question, I want to build on what Chris said. She talked about being courageous. We have a saying at AppLog that courage is contagious, and it is. The majority of us don't do induced abortions. It's not healthcare. And just a few years ago, I was busy doing my own thing, not really paying attention to what was happening. And I think that's what a lot of hardworking OBGYNs, healthcare professionals who are taking care of moms and babies are doing. But I'm going to challenge you to get in the game, get in the arena, open your eyes. We all have to wake up. We talk about, there's only a small percentage of OBGYNs that perform induced abortions. The majority of us don't. And that majority is a silent majority to a large extent. We have to grow that base, and we have to be bold about it and not be afraid. So this is a time, if we're going to move forward and try to restore our medical practice, we need every single person. So how do we get them involved in addition to the way Chris said? I think when you think about the media, when you think about policy, is turn to us. We're working really hard at AppLog, and now we have AppLog Action, to be a resource, to be a trusted person that you could go to if you need an interview, if you need a podcast, a webinar, if you need, as in policy, thoughts on bills that are being written. We want to be part of that process. We support policies that protect the lives of both our patients. And so we want you to engage us there. And I think for me, I have a special heart for the pregnancy center movement with over 2,700 centers across the country. We have had a beautiful model of a lot of healthcare professionals, particularly the medical directors, the doctors, being volunteers. They have their busy practice and then they volunteer a little bit. I think there are an awful lot of mid-career OBGYNs that maybe are looking for a shift in how they're working, or those that are my age who have helped women deliver a lot of babies, but now we're not ready to retire, but we're doing things differently. And so I work in 4 pregnancy centers. I get paid to work in those pregnancy centers. I see patients with unplanned pregnancies. And so I'm going to challenge those 2,700 pregnancy centers out there is to look for medical directors. You don't have to pay them what, they made in private practice, but we don't want to lose all those people to the health departments, the federally funded clinics. They're all good places to work, but we need to let doctors know that they're wanted in the pregnancy center movement.
Absolutely. Yeah. So no matter where you are situated in your life and in your career, there's something that you can do. And pro-life medical professionals, they want to partner with you. You want to help advance life-affirming medicine. They want to help advance life-affirming medicine. So really, there's a lot of opportunities there. Definitely with the pregnancy resource centers, AAPLOG, we have over 7,500 members, and those are all medical professionals that you can potentially tap into as a resource, whether it be for medical director positions at your local pregnancy resource center, or just for thoughts on legislation, as Dr. Bane mentioned, or for just media interviews, podcasts, and things like that, just to help us get the word out, get the information out there. It's all really important to do. So yeah, Dr. Francis, just to close out with one last important point about the vision of this campaign. What is the future that AAPLOG is trying to build in the medical profession and in our nation's culture?
Yeah, absolutely. Well, we are so excited about the next few years for AAPLOG as an organization, but also for women's healthcare and pregnancy care in this country. If you look back at the roots of medical ethics, the Hippocratic Oath, digging back more than 2,000 years in history, part of the reason why it came about and became the basis of medical ethics was because um, Hippocrates and his students recognized that intentionally harming someone or intentionally ending someone's life had no place in the practice of medicine, and that the practice of medicine should be set apart as a profession, as something that someone professed their lives to, and that professional, that physician, should have what we call a fiduciary responsibility to their patient, meaning that's a very special relationship that you as the physician are to some extent in a place of power in that relationship with the patient, because you have this knowledge and your patient is coming to you in a very vulnerable moment. But because of that imbalance of power, that we actually have a very unique and special and weighty responsibility to our patients to not abuse that power and to ensure that we are entering into this special relationship with them to promote their health. And I've heard Dr. Bane say many times that the purpose of medicine is health, healing, and wholeness. And that's so true. That's what our profession is about. And so we are excited to, yes, restore that. So restore that ethic that was at the basis of our profession. But the reason we decided to call this new initiative A New Path Forward is because it isn't about looking back. Yes, we are going to restore those basic principles that should be there in medicine, but we are in such a different time right now, culturally, in our profession, all of that, that we really do have to forge a new path forward. And I think for the medical professionals that are listening to this, I hope that that message resonates with you, as it did with all of us, our entire board of directors, as we sat around discussing, what are the next few years going to look like, and what do we need to do as an organization? And that new path forward, I think, in my mind, just brings up something refreshing. And I know for so many people in the medical profession, there's a lot of burnout right now. There's a lot of red tape that we have to deal with. There's a lot of frustrations that we deal with in our profession. And I think a big part of that is because we've lost our way as medical professionals. We've lost our purpose. And so we are helping people find their purpose again in this thing that we are all so privileged to get to do, which is to care for patients in their most vulnerable times. And so our hope is that we can help restore joy to the practice of medicine for our members. And in doing that, that we can begin helping people provide much better care to our patients, to both of our patients, both moms and babies. I think if we just take time to think about a world in which both of them are respected, both of them are supported and promoted, and that we really truly then can see flourishing of our patients. That's such a better world to imagine, I think, not just for medicine, but for everyone in general. And so that's really the driving force. And I do think that this is going to be speaking to the hearts of medical professionals who are fed up with a lot of what's going on in medicine right now. And a big part of that has to be holding to account these powerful medical associations that are putting politics and probably financial interests and these sort of ideologically driven narratives over what we know to be good patient care. And they need to be held to account. And we're seeing this, of course, in a variety of venues in our culture on many different issues, not just on the abortion issue. But I think maybe for anybody who might be thinking, surely this isn't going on, really all you have to do is look at some of these other issues where we have discovered that other interests have been put ahead of good medical care, that it's not too far of a leap to realize that that's happening in this situation as well. And so we need to be holding these medical associations to account. And as my colleagues have said, we are hoping that with this new vision, it will help inspire courage in other physicians. For non-medical people who are listening, who might be wondering, why aren't there more doctors speaking out about this? If this is what's going on, why aren't they speaking out? Well, the reason for that is because they're scared. They're providing for their families, and they have been told by some of these major medical associations that they need to be quiet, or if not, they could face losing their certification or their jobs. And so we are calling them on that. We're calling those medical associations on that to say, you must allow for there to be open and academic debate. You must allow for diversity in viewpoints so that we can, again, advance medical knowledge and advance the care that our patients are receiving. And I'll just wrap up with one final thing too. Of course, we are a medical organization. Our focus is on physicians and other medical professionals and ensuring that accurate medical information is out there for the entire pro-life movement. So for people who are non-medical who are listening to this, you might think, well, okay, what does that really have to do with me? Well, I want you to picture if you, or let's say your daughter is pregnant and finds herself maybe in a scary situation, whether it be an adverse diagnosis for her baby, or maybe a threatened miscarriage or some other pregnancy complication. And she really wants to go see a physician who she knows is not only going to provide her and her baby with the best care possible, but is going to fight as hard as they can for both her and her baby to try and help ensure that they both can have good outcomes. If people don't get behind us as an organization, I don't think this is overstating, I really don't. If people don't get behind us and what we're trying to do in changing the path that our profession is on, there could very well be a day where you won't be able to find a physician who is going to fight really hard for both you and your baby, who their only option that they will give you in that situation would be an abortion. And so I think people really should think about that and think about the kind of care that they want for themselves, regardless of where you stand on the issue of abortion. If the kind of care you want for yourselves and for your family is that the physician who comes into the room isn't going to suggest, first off, that either your life be ended or the life of your child be ended, then you should care about the success of this new campaign that AAPLOG is doing, where we're trying to do something really big, which is change the trajectory of the medical profession, at least when it comes to beginning of life issues. So it's a tall order, but it's something that we know that we are equipped to do, and we are asking people to join with us, whether you are medical and you join as a member. And you don't have to be the one speaking up on the media. We can do that for you, or you can join with us if you want to, but at least to join with us so that you can be a part of this movement. And if you're non-medical, then we encourage you to join us as a supporter. Or if you're in the media listening to this, we encourage you to reach out and talk to us to maybe hear a different perspective that you haven't heard before.
Absolutely. That was so well said, Dr. Francis. I'm pretty tempted to just kind of wrap things up and let everybody go home. But just in case everybody listening isn't as fired up right now as I am, I just want to emphasize just the importance of this, how high the stakes are, whether you're a medical professional and you're fighting for the purpose and the very core of your vocation, or if you're just an average pro-life American who just wants themselves and their family to get life-affirming care that values the dignity of themselves and all of their children from the moment of fertilization to the moment of natural death. No matter where you are in your life and in your career, you need to turn to pro-life medical professionals. I know I'm biased because I work here at AAPLOG, but I would say that the pro-life medical professional voice is one of the most important, if not the most important, in this fight to build a life-affirming culture. So thank you so much, ladies, for being at the forefront of this fight and for fighting so hard and so persistently to change the medical culture and, in turn, the culture of this country overall.
Okay.
Thank you.
Absolutely. And thank you so much to everybody listening. I hope you enjoyed this episode. Again, I just want to reemphasize, go to aaplog.org/mobilize to learn more about this campaign and to learn what you can do to mobilize and stand besides these pro-life medical professionals to help change this country and to help change the culture of medicine. If you like this episode, give us a like and subscribe on our YouTube channel, or if you're listening on a podcast app, be sure to give us a 5-star review. I look forward to seeing you next week for our next episode.